Well, thank you all so much for coming out today, Representative Candelario, the other representatives, and Senator Winfield for coming out today. Thank you, Sam. It's important to notice that currently, nationwide, there's 61% support for legalization, and that's Americans were polled. My name is Colin Sowney. I'm a resident of Guilford, Connecticut. I'm also a daily cannabis user and have been for over 15 years. I'm a small business owner in the state of Connecticut, and a patient also. According to the Connecticut State Office of Fiscal Analysis, the current state deficit looks to grow to an astounding $4.3 billion by 2020. Business in this state are beginning to move out, and so are the families they support, as well as the small businesses that benefit from the income of the working class keeps within local economies. With the deficit increasing and the tax base decreasing, there is little sight of recovery. And even Moody's Investor Services has considered decreasing Connecticut's rating. Add to this increased taxes, talk of tolls, jobs, subsidiaries, and other budget cuts, and it becomes apparent there needs to be a change and industry needs to be brought into Connecticut. It is clear there's a serious issue that needs to be seriously addressed and aggressively managed. As the country's fastest growing industry, cannabis must be reviewed as a source of possible income to help secure the instability within the state's budget. Currently, Connecticut's population is 3,500,000. Age 18 to 65 working adults and college students make up 63% of Connecticut's population. 23% of 18 to 25-year-olds have consumed in the last month, and the number is rising. Also, 6% of people above 25 have consumed in the previous month. Following these numbers for Connecticut only shows a huge demographic availability. Of the 2,265,000 residents 18 to 65, it is estimated that 238,000 are in the 18 to 25 demographic, with over 54,000 possible consumers in Connecticut alone. In Connecticut, there's 54,000 possible consumers spending an average of $68 per week currently. This is money that is being transferred in the black market right now. That's a polled number, and many Americans do not admit to consumption, and it is anecdotal that that number may be as high as $350 million. We should regard the same for residents of Connecticut. The average potency of recreational product can vary from as low as 5% for some open growth product to as high as 30% in engineered controlled environments. If we review a 300-mile radius for consumption, and if you review the population of Oregon, Colorado, and Washington, you will find that the population of those three states is just over 16 million. In a 300-mile radius of Connecticut, including parts of Pennsylvania, New York, and all of New England, there is over 56 million people in the same amount of area that Colorado, Washington, or Oregon cover. That's 56 million people. That's 3 times the amount of the other 3 legal states in totality. There's an astounding number attached to that. If Connecticut were to roll out with legalization prior to any other state in the Northeast, there is a potential for over $65 million per week in gross sales, or over $3 billion in gross sales annually. This is an astounding number and will benefit the first state to legalize. It's important to note that Massachusetts is going to be passing an initiative in November, and they actually stand to probably benefit from this $3 billion number. With discussion of legalization, there needs to be attention paid to the potential addictive nature of cannabis and the possibility of it being a gateway drug. People nationwide are beginning to speak out against increased pharmaceutical use as a safe alternative with negligible side effects when compared to the possible side effects of some of these FDA-approved drugs. Even Baltimore Ravens offensive tackle Eugene Monroe speaks out using cannabis for pain relief instead of possibly more addictive drugs. Doctors are prescribing more and more every day, even for children, drugs like amphetamines, including Adderall and Ritalin. or psychoactive benzodiazepines, including Xanax or Valium. And finally, opiates, like OxyContin, morphine, or fentanyl, are often prescribed with warnings and possible devastating side effects, as well as addiction and the withdrawal symptoms that come with stopping use of some of these drugs. Some of these side effects can lead to death or serious detriment to health. Cannabis studies to date show no adverse side effects or any evidence that it may be a gateway drug. The current trend in community seems to be that people go for the doctor for pain, depression, or other condition, and the doctor prescribes an addictive medication. It should be noted that with legalization, there is a plausibility that healthcare costs would be reduced and the burden of expense to insurance companies would also be reduced. With legalization in this state will be a benefit of earning from not only the taxation of the product, but the economics involved through job creation. The current marijuana program has created over 225 jobs that support just over 8,000 current consumers. Following that trend for the estimated 85,000 current consumers in the state of Connecticut shows a potential for over 2,000 jobs here in Connecticut. Taxing and regulating cannabis, similar to alcohol, seems to be the logical answer for the state. With an already established alcohol regulation committee and distribution network, integration of cannabis into that industry seems sensible enough. Personally, my ex-wife and I operated a package store here in Connecticut for several years until 2007. Its operations were heavily regulated by the state, and the processes and procedure that were in place, including enticement to sell, also seemed to make sense for cannabis. Volume, potency, weight, and tested THC content could easily be used for taxation base at bulk sale to retailers, leaving the retailer responsible for sales tax only. It's important to note that out of that $3 billion, what 6.3% sales tax looks like, by the way. The alcohol industry already has heavy regulations against sales to minors, and those could be enforced also if legalization were a reality. Currently in Connecticut, operators of motor vehicles are subject to field sobriety tests if they are suspected to be under the influence. While these are not 100% conclusive or bounds for evidence, if the administrating officer were to be wearing a camera and the events were recorded, the opinion of the officer may be substantiated, and as a result, further testing through urine or blood could be administered. I'm not a lawyer, and I'm unsure of the exact implications, but it seems to me that integrating the current field sobriety test into a legal marijuana market makes sense for public safety and policy. It's also important to note that current crash culpability studies show, quote, in contrast to alcohol or cocaine, for both men and women, the study, and many like it, did not find an association between crash culpability and marijuana use. And there's several studies citing this. These are government studies, they are nonpartisan and unbiased. Thank you very much. I look forward to answering any questions that anybody may have. Thank you.